Good afternoon, everybody here in Asia. Good morning to anybody joining us from Europe. My name is Chris Humphrey. I'm the Executive Director of the EU-ASEAN Business Council. Welcome to this, our launch webinar for the EU-ABC's report on transforming diagnostic access, a roadmap for ASEAN. I think as the COVID-19 pandemic has revealed, diagnostics play a critical role in screening and diagnosing and containing the spread of diseases. In fact, prior to the pandemic, the World Health Organization emphasized the importance of diagnostics, advocating for the creation of an essential diagnostics list to enable countries to detect and better manage key diseases within a nation. Despite their rallying call, diagnostics has persistently been undervalued. It has consistently remained the biggest gap in the cascade of care, suffering from low visibility despite its value in a holistic approach to healthcare. We intend today, I think, to have a deeper dive into this subject with my expert panel coming up a little bit later on this webinar. We kick off, though, with some opening remarks from His Excellency Lim Jock Hoi, Secretary General of ASEAN, and then followed by a keynote speech from Dr. Boon Feng Puma-Lasith, who is the Minister of Health in the Lao People's Democratic Republic and the current chair of the ASEAN Health Ministers. And after that, we'll move into our panel discussion. Thank you, everybody, for joining. And I think without further ado, we will then move to the opening remarks from His Excellency Dato Lim Jock Hoi.
Excellencies, distinguished representative, ladies and gentlemen, a very good afternoon. I'm pleased to address you today at this important webinar on transforming diagnostics access, a roadmap for ASEAN. I commend EU-ASEAN Business Council for organizing this event to examine the state of play of diagnostics across ASEAN and its relevance to building a resilient healthcare system in the region. The COVID-19 pandemic has been a stark reminder of how public health challenges transcend sectoral and geographical borders that requires the engagement of all stakeholders at all times. Its devastating impact has been particularly hard on the most vulnerable group in our society, such as the elderly, women and children, migrant workers, as well as micro, small, and medium enterprises. In this regard, ASEAN's Comprehensive Recovery Framework and its implementation plan have been critical in ensuring the region's response effectively to the pandemic's social and economic impact, as I'm pleased to note that we are emerging safer, stronger, and more resilient as a community. As a result of a whole of a community approach, ASEAN's trades volume have returned to pre-pandemic level, and we are confident that the region will meet its projected growth of 5% this year and 5.2% next year. Excellencies, ladies and gentlemen, nevertheless, we must remain vigilant against risks that may impact our recovery, such as disruption in global value chain, price volatilities in the global market, especially in energy and food commodities, rising costs in logistics and transport, as well as the economic slowdown in major economies. We should also leverage on lessons learned from the pandemic to ensure that we are better prepared for future health threats with multifactorial consequences, including by building a resilient healthcare system in the region. In this regard, allow me to highlight some of these efforts ASEAN has undertaken. Firstly, through the leadership of the ASEAN health sector, we have sustained and scaled up regional initiatives in responding to all hazards and emerging health threats, including COVID-19 and monkeypox. The 15th ASEAN Health Ministers meeting held in May 2022 reaffirmed our commitment to pursue advancement of ASEAN health development build regional health system resilience, as well as accelerate COVID-19 recovery. In particular, ASEAN Health Minister agreed to prioritize strengthening access to vaccine, therapeutic and diagnostic, and other essential medical supplies. Second, ASEAN is implementing recovery initiatives on enhancing health system and accelerating inclusive digital transformation as guided by the comprehensive recovery framework. These focus on maintaining and strengthening essential health services, mobilizing resources through multi-stakeholder partnership while maintaining ASEAN centrality, maximizing opportunity presented by digital technologies to boost the economy post-COVID-19 and increasing intra-ASEAN trade and investment in strengthening supply chain resilience. Third, our whole of ASEAN response has been realized through the ASEAN Coordinating Council Working Group for Public Health Emergency that facilitate cross-pillar community engagements. Further, the gradual opening of the region's economy has been supported by the digitalization and harmonization of the ASEAN Health Protocol that complement travel corridor arrangements by the Regional Comprehensive Economic Partnership Agreement that came into force in January 2022, which provide a stronger anchor for greater ASEAN engagement with the global market. Recognizing that COVID-19 will not be the last threat to our health, ASEAN is further enhancing the public health emergency coordination mechanism through the development of the ASEAN Public Health Emergency Coordinating System, as well as the launching of the ASEAN Center for Public Health Emergency and Emerging Diseases. These will serve as a regional hub for disease prevention and control, as well as coordination through One Health approach with relevant partners. Excellencies, ladies and gentlemen, the return to business as usual is no longer an option for the region. We must collectively work together, including the private sector, to enable a systematic change for ASEAN's sustainable and resilient future. In this regard, I would like to encourage greater investment in diagnostic, treatments, and more mobile health application, as well as realizing a resilient healthcare system in the region. To end, I look forward to further exploring how we could collectively pursue our shared goals towards a world that is safer, more secure, more inclusive. I wish you a successful webinar. Thank you.
Thank you, Excellency, for those remarks there. Very pertinent, and particularly welcome the call for greater investment in diagnostics across the region. We now have a keynote address for our audience from His Excellency Dr. Boonpeng Pumalesith, Minister of Health from the Lao PDR and the current chair of the ASEAN Health Ministers meeting in the region. Again, pre-recorded. You can play that video now, please.
Excellency, distinguished representatives, a pleasant day to all of you. Please allow me to express my appreciation to the EU-ASEAN Business Council for your kind invitation and for the excellent arrangement made for this valuable webinar on transforming diagnostic access, a roadmap for ASEAN. As the current chair of the ASEAN health sector, allow me to share the commitments and policy direction that were made by the ASEAN Health Minister during our 15th meeting in May 2022 in Bali, Indonesia. They are health-related initiatives with cross-cutting concern that are relevant to building healthcare system resilience through the strengthening of information, diagnostic, and therapeutic landscape in the region. The ASEAN health sector is committed in advancing the achievement of the ASEAN health development. Since the start of the implementation of health-related strategic action points from the ASEAN Socio-Cultural Community Blueprint in 2016 up to 2025. These health-related action points are currently being realized in the ASEAN region through the implementation of the ASEAN post-2015 Health Development Agenda for 2021 to 2025 via the work programs of its 4 ASEAN health clusters. Primary implementers are the ASEAN member states through their respective health ministry together with the ASEAN Secretariat. These are also implemented in cooperation with external partners which have similar interests among goals with the ASEAN architecture with no conflict of interest with the vision and mission of the ASEAN health sector. Excellency, distinguished representative, in moving toward a healthy, caring, and sustainable ASEAN community, kindly be informed that there are ongoing regional initiatives that focus on health priorities in promoting healthy lifestyle, responding to all hazards and emerging threats, strengthening health system and access to care, and ensuring food safety. Included in this initiative are those that strengthen capacity, and collaboration to prepare, detect, prevent, respond, mitigate all hazards including communicable, emerging, and re-emerging infectious diseases and zoonotic diseases. In addition, there are also program and project initiatives that will promote and advance universal access to safe, affordable, quality health care and essential medicine and vaccine and utilization of digital health technology, research and development, and innovation in advancing health system and access to care for the ASEAN people, in particular the vulnerable population. More concretely, the ASEAN health sector has priority activities on digital health and health information system, which include, among others, first, experience sharing on using digital health to increase health service and improve universal health coverage based on the lessons learned from the COVID-19 pandemic. Second, development and establishment of the ASEAN health sector knowledge management platform to accelerate and improve its business process by making data and information more accessible. Third, enhancing capacity on the use of digital technologies for supporting the health system and improve access to health care. And fourth, promotion of health technology assessment and its capability building for relevant stakeholders in ASEAN to inform policy decision-making in health care and improve uptake of appropriate technologies, including diagnostic. Relevant to the various commitments of the ASEAN health sector in building regional health system resilience and accelerating COVID-19 recovery, the ASEAN health minister also agreed in May 2022 the strengthening of access of vaccine, therapeutic, and diagnostic and other essential medical supplies dedicated to general pandemic preparedness and response. Excellency, distinguished representative, in moving further ahead, the ASEAN health sector will collectively forge stronger multi-sectoral collaboration through agreed mechanisms in sustaining and scaling up public health priorities in the region, including addressing public health emergency and further emerging health issues, while preserving ASEAN centrality. The ASEAN health sector will also foster closer collaboration and dialogues with relevant partners on potential and agreed initiatives aligned with the ASEAN post-2015 Health Development Agenda for 2021 to 2025 and other health emerging issues. Strengthening the effective and efficient cooperation with external partners in developing a resilient healthcare system to battle disease and better equip this system for future health threats would primarily be guided by the vision of the healthy, caring, and sustainable ASEAN communities. To end, I look forward to the results of this webinar and its subsequent follow-up, which can be valuable for the ASEAN health sector. I wish you success in all this activity. Thank you very much.
Once again, a very big thank you to His Excellency Dr. Lim Jock Hoi for his opening address, and to His Excellency Dr. Boon Feng Puma-Lasith, the Minister of Health from Lao PDR, for that keynote speech. Lots of us for us to talk about there. Before we launch into our panel discussion, I will very quickly take you through a brief overview of our new paper, Transforming Diagnostic Access, a Roadmap for ASEAN. The QR code is on your screen here. I'll leave it there very briefly so that you can download the report, but I'm happy to announce the report is now live and published, and indeed on our website. This paper has been a long time coming. It highlights the opportunities and merits of diagnostics before moving on to underscore the common gaps and problems hindering its adoption in ASEAN. We then, in the report, provide targeted recommendations for relevant stakeholders for their consideration to undertake to develop a resilient healthcare system for member states. The report will also contain a section on the country overview of selected ASEAN member states, namely Indonesia, Malaysia, Singapore, Thailand, the Philippines, and Vietnam. As I mentioned, scan the QR code, you can get the report there, or please visit our website, www.eu-asean.eu, and you'll find the report on our website there as well. The paper itself is built on the findings. Sorry, next slide, please. Other direction. Thank you. The report itself is built on the findings of a report that was published by the Lancet Commission back in 2021, which stated that diagnostics is the biggest gap in the cascade of care that translates to high mortality rates for deaths that could actually be averted. The Lancet Commission uncovered that despite its merits, diagnostics has always been sidelined, with priorities given to vaccines and medication. But diagnostics does have value, and as we highlight in our report. Value of diagnostics, if we place it in the ASEAN context, is manifold. It delivers safe, affordable, and better targeted healthcare for patients. It helps with the early detection of diseases to improve patient treatment outcomes. It lowers costs for healthcare systems and patients alike, and also aligns very well with the ASEAN Health Cluster goals and the post-2015 Health Development Agenda that you just heard the Minister talk about. So, from this assessment, value, as it is interpreted by the EU-ABC, is not measured solely in economic terms, but from the whole stakeholder perspective. especially as a tool to help ASEAN achieve its health development agenda and for pandemic preparedness. This was specifically highlighted in this year's joint statement during the 15th ASEAN Health Ministers meeting, where the health ministers in the region collectively acknowledged the importance and need to strengthen access to vaccines, therapeutics, and diagnostics, dedicated to the general pandemic preparedness and response. But of course, while it took a pandemic to highlight the importance of diagnostics, this should not be the case. Diagnostics should be a reactive approach that comes about only from an emergency response perspective, but it is a function, rather, should be more of a wholesome assessment. In other words, it's something that we should be investing in for the long term and investing more in it now. Which is where we at the EU-ASEAN highlighted in this report that the true value of diagnostics lie in its ability not only to combat pandemics, but to produce solutions for various stakeholders within the healthcare continuum. These stakeholders include the patients, physicians, healthcare and medical providers, payers, and policymakers. But for the ASEAN member states to tap onto this value for benefits for all, there are gaps that need to be addressed, and there are ways to tackle them together through public-private partnership. It is important to continue harnessing on this momentum inherited by COVID-19 and to keep the conversation going about its importance and indeed to invest more in diagnostics. Today, we will continue that conversation with our wonderful panel here, joining me in advocating for the importance of diagnostics. We have with us today Lance Little, Managing Director and Regional Head Asia Pacific for Roche Diagnostics, Sanjeev Johar, who's Divisional Vice President, Rapid Diagnostics Asia Pacific at Abbott, Professor Dr. Louis Lai Meng, who's a pathologist at the University of Malaya Medical Center, Dr. Eduardo Banson, Principal Health Specialist, Southeast Asia Department at the Asian Development Bank, and last but not least, Thomas Hatton, Country Portfolio Manager, High Impact Asia Department at the Global Fund. Welcome all of you to this conversation today. For our audience, please, there's a Q&A box at the bottom of the screen. Don't be shy in posting questions in it. I'll do my best to get to them as we get through this conversation in the next 50 minutes or so. Hope everyone is feeling comfortable. Lance, let's start with you, please. You've seen the report which we've written, and you just heard the mentionings there from the Secretary General and from the Minister. But from your point of view, from the Roche point of view, what are the existing and foreseeable healthcare challenges in Southeast Asia, and how would developing greater diagnostic capability help to address those challenges?
Yeah, thanks, Chris. Thanks for the opportunity, and congratulations to everybody who put the report together. I think it's really getting to the heart of a lot of the key challenges that those of us have seen in and around diagnostics. We've been around this industry for a long, long time. So it's great to see the messaging coming through. I think the question around the role of diagnostics within the ASEAN healthcare environment, I think is fundamentally the same as anywhere else actually in the world. I mean, diagnostics has been foundational to healthcare in any healthcare environment, whether that's a very well-developed healthcare system or a developing one. The question is, to which extent is it utilized? And I think what we saw with the effect of COVID on healthcare systems across the ASEAN countries is the load of COVID really had a different impact on the healthcare systems depending on how strong they were to start with. And I give you an example with that. We had some of the ASEAN countries had access to molecular technologies. The platforms were in place in hospitals. The lab staff knew how to utilize molecular technologies. And when COVID came along, they were able to deploy. It put a lot of pressure on, but they were able to deploy off a knowledge base that was already there. Yet we had other countries where that knowledge base was not there. The utilization of the technology had not yet been established in a particular country. So then we had to mobilize and work very closely with the local government institutions, the hospitals, to upskill people in the emergency environment and in the moment to actually get base technology understood and utilized. And look, we got there, and I think credit to the people that were the front line of doing all of this in real time. But what it highlighted was some countries had access to technologies and others do not. Yet if a base level of health is going to be established across any particular country, fundamental diagnostic technologies need to be in place in that country, well embedded into the healthcare systems, where the staff and the people doing the tests understand the technologies and then can deploy an emergency situation where needed. So for me, I look at this development and of diagnostics on two axes. One is, if you like, the horizontal axis, where we need to ensure that base level diagnostics, which are forming 60 to 70% of clinical decisions, are well established and available to everybody in the population. And that exists to a greater or lesser degree in different ASEAN countries. And then there is the, if you like, the vertical axis, which is more the nth degree of personalization that comes with diagnostics. You know, genomic profile to treat an individual patient's cancer in the most effective way. That's a role that diagnostics plays as well. Now that's perhaps the luxury that comes secondary to a base level of good diagnostics that can support a healthcare system for the entire population. So I think the challenge and the question is the same for everybody. In my view, we have countries at different levels of that development, and that's been highlighted as a result of COVID.
Thanks, Lance. Very comprehensive view. Sanjeev, I'll turn to you, having heard what Lance was saying. Do you believe that diagnostics adaptation has improved over the years? Has COVID-19 spurring more interest in having more diagnostic tools at hand? You're on mute, Sanjeev, sorry. Still muted.
Yeah, okay.
Okay, gotcha.
Sorry about that. Thanks, Chris, and pleasure meeting all other panelists, and thanks for the opportunity. As we all know, a person's healthcare journey starts with and depends on diagnostics, and early accurate diagnostics is the key. Although the diagnostics infrastructure has improved considerably over the years, there are still a lot of gaps due to resource constraints and the geographical spread of the area that we are operating in, which is Asia Pacific in general and ASEAN in particular. A lot of our population still lives in far-flung areas. So over the years, definitely the diagnostic adoption and the usage has improved considerably in almost all the countries and various settings. But the COVID pandemic has not only reinforced but elevated the role diagnostics play in disease prevention, diagnosis, prognosis, surveillance, therapy selection, and overall disease management. Particularly as we have seen, and there in many examples of community surveillance and hotspot management, economic resilience and recovery, travel resumptions and reopening of borders, which we had not seen in pre-COVID scenarios, and also supporting vaccine rollout. So we can see here that diagnostics is now the acceptance and adoption has now gone to a totally different level. And COVID has enabled a better recognition on the value of diagnosis, especially on the critical role of point of care, because the first line of diagnostics during the COVID pandemic, as we saw, was the rapid tests and ART kits, along with, of course, the PCR and the molecular solutions. So this has complemented, and I think as we have seen in many countries, the overall adoption and the acceptance of diagnostics has increased manifold.
Thank you very much. Dr. Louis, I'll turn to you. The report that the Council's published today draws quite heavily on the previous one from the Lancet Commission. The Lancet's report actually really looked at mostly at the gaps in diagnostics in South America and in Africa. How do you see the situation here in Southeast Asia? Is it fair to compare ASEAN to those regions? Does ASEAN face the same operational barriers in terms of access to diagnostics?
Thank you, Chris, for that question. Well, I'm very honored that I was a member of the Lancet Commission. So when we drafted the commission report, we needed to cite very definitive published information. And there is generally a lack of good published studies on the diagnostic gaps in ASEAN. That is why the focus was more on South America and regions in Africa. But I mean, we had perceptions, observations, small surveys that we looked at. But I would say that working and living in ASEAN, I can still relate the commission report to ASEAN. There are similarities, there are some differences. The similarities are that diagnostic is still a major, a major and the weakest gap in the cascade of care. Maybe the examples cited in the commissioned report may not be absolutely spot on for Asia, for ASEAN, but in general, we can say that there is diagnostic gaps, especially still at the primary care level and the community level, and at the other end of the spectrum, at the high end level, at the tertiary level. We tend to have in ASEAN a very big use of diagnostic, a wide range of diagnostics in the media tier level, at the hospital level. But at the community and primary care level, I think what the commission report points out is still very true. When we talk about NCDs, diabetes, heart disease, and so on, if at the community level, these are not detected, then they are not escalated up for further testing. And this is still a big problem in ASEAN. We have a huge NCD problem, and there are lots of people out there who are just not diagnosed, not detected. So how can we say that we are achieving universal health coverage? On the other hand, at the other end of the spectrum, we have lots of people who do have diagnosis made, for example, of cancers and so on, but they need the other end of therapy, the precision medicine, targeted therapy, and so on. So we can ask ourselves, are the diagnostics available and affordable for these people in ASEAN so that they can assess the best possible care for their diseases? So that is the other end, which I think Lancet also referred to. There is a gap there, the diagnostic gap in terms of more detailed assessment of a particular disease such as cancer so that they can benefit from targeted therapy. And while that may be available in some ASEAN countries, they may not be accessible in an affordable manner. So it's those who can pay out of pocket, who are rich enough, they can access such molecular and high-end tests. But the common man, I think, would find this not accessible in that it is restricted by affordability. So the message of the Lancet Commission regarding access to diagnostics is still very relevant. It's certainly relevant for ASEAN. The difference is, of course, in ASEAN generally compared to the examples used in the Lancet Commission, we have more developed infrastructure and there's more human resource capacity building, although there is some variation that Lance referred to. There's also better partnerships with Singapore, China, India, US, Europe for R&D. I think that spells well for it. The the private sector, private laboratory capacity is fairly comprehensive. I think more comprehensive compared perhaps to Africa and South America. But even then, the problem of accessibility limited by affordability still lies as one of our major challenges, in that the rich can access, but those who cannot afford are in a sense left behind because they cannot pay out of pocket. So I just end there first.
Thank you. Dr. Eduardo, given what Sanjeev said about diagnostics being key to the healthcare journey, it's at the beginning, the middle, and the end of that journey, and what Dr. Liu is just saying there about affordability of access, and the fact that diagnostic tools themselves actually are still limited in large parts of Southeast Asia. How can we do more to get them incorporated into universal healthcare packages and promoted as a vital tool in the region?
I think, Chris. Okay, so what we are seeing right now is that, for example, there's a lot of countries are investing a lot on primary care. Okay, it's in the discussion on UHC, primary care has been identified as an area which countries should scale up. And when you start talking about primary care, to what extent should that include investments in diagnostics? In a lot of Asian countries, in Southeast Asian countries, like ultrasound is not part of primary care. So having that discussion on what diagnostics should be there, should ultrasound be part of, like what Lance is saying, the base diagnostic that should be in primary care? Would X-ray machines? Would the convenient point of care diagnostics? Okay. This discussion is not happening. And if this happens, then once we start talking primary care, then this becomes part, and that would actually scale up investment in diagnostics. So we basically step away from saying invest in diagnostic per se, but really primary care should have these diagnostics. Similarly, when you start talking, for example, about health security, lots of countries really want to strengthen their national health laboratories. And once you start talking about that, that means strengthening diagnostics for surveillance, for screening, and all that. So again, it's not a discussion of diagnostics per se, but really strengthening disease surveillance, strengthening centers of disease control, sharing of data, national health laboratories. So that's the kind of engagement we have right now with countries. And so we focus more on this type of interventions and just bring up the diagnostics, something that should be part of that. And having Lance, Dr. Meng, and Sanjeev, bring in more of this, that, we can't talk primary care unless you have this base diagnostics, that would be very helpful in the discussion.
Thanks,
Chris.
Thank you. Thomas, you're coming from the Global Fund. The Global Fund itself has been investing heavily in battling infectious diseases around the world, about $4 billion US, I believe, across 100 countries and territories. What are some initiatives that you've been using in ASEAN member states to help prevent the spread of diseases, particularly HIV and TB?
Thanks, Chris. Pleasure to be here. So for a quick bit of context for anyone who doesn't know us, we invest a significant proportion of those annual investments, which are about $4 billion every year, via grants to more than 100 countries. And these grants will finance the fights against HIV, TB, malaria, COVID, and they'll also go to build resilient and sustainable systems for health. So we will finance diagnostic tools, but equally importantly, the kind of things which have been spoken about by the other panelists so far. So building robust national labs and strengthening them where they're already there. Two of the most pertinent initiatives which we've been really pleased to be involved in the ASEAN region over the last few years have been, first of all, in TB. So for anyone who's new to TB, TB is one of the most deadly infectious diseases. It kills about 1.3 million people every year. In 2020, just in Southeast Asia, about 4.3 million people fell ill with TB and 700,000 of them died. TB is an entirely curable disease. So in this case, what we've done is we've supported the scale up of rapid molecular diagnostics as a point of care, which a number of panelists have already spoken about. In this case, the point of care is often a primary healthcare facility. so that people can get rapid, accurate test results. Often a big problem is that somebody will do a test and they won't get the result back for a number of weeks, which obviously heavily disincentivizes turning up for a test. Molecular diagnostics can also determine whether or not an individual has drug-resistant TB and make sure they get an appropriate treatment regimen. So this is actually entirely the kind of sort of foundation of the kind of hybrid testing network models that you mentioned in your report. The second, which is close in everyone's mind still, is the remarkable efforts which many countries in the region made to dramatically scale up their COVID diagnostic systems. So we took a leading role in supporting the rapid and equitable deployment of technologies across the range, which have been mentioned again by other panelists, to support the COVID-19 response. In many countries, I think one thing which we really shouldn't forget is that these initiatives were really very successful. When you compare with the average trajectory of disease, the way in which many countries handled COVID was really, with some bumps, really very good. And they illustrate what we can do in this sphere when we really want to. As we look forward, we're going to continue. We have a replenishment coming up next month, and we'll be doing a new round of grants at the end of this year. So we will continue strengthening labs, surveillance systems, and investing in diagnostics across the region.
Excellent. Thanks, Thomas. Lance, one of the things that's really striking about what Thomas just said really was that the lack of proper diagnostic tools means that people die of diseases which are actually entirely curable. And I think across the region, only about 2% of healthcare spending goes on to diagnostics. How can we get policymakers and the ministers of finance and ministers of health and others to really understand the true value of diagnostics and ramp up that investment?
Yeah, I think one of the fundamental challenges here is we need to be comfortable, we being the health industry as a whole, policymakers and funders and everybody involved, and having the conversation and the concept around investment today, return tomorrow, right? So if we take, TB is a great example. If we take HPV for cervical cancer is another great example, a curable cancer. And, if we're investing up front now in the right screening programs, then there is no question we're saving women's lives down the road. One of the challenges that I think we need to grapple with is the willingness to invest today, $1 today, and save thousands down the road. And I think that's been evidenced in the report, actually, when we look at the cost or the value of diagnostics to various countries that was articulated. And I think if you take Thailand alone with HPV, I think it's in the order of $2 trillion. So, I think this is very, very clear. Everybody intellectually understands that, but taking action and funding something now that will not give returns potentially until a number of years down the road is something that we have to have an honest conversation around, as opposed to going directly into the more acute here and now dynamics, which is the easier conversation to have. So, investing more in emergency department, et cetera, to enable them to treat cardiac patients better. That's a real problem, no questions about it. But that's a different conversation to what often sits with the diagnostic one, which is we can get information now which solves problems down the road or avoids problems down the road. And I think this is one of the fundamental conversations we've got to get better at. And I do wonder, listening to Eduardo talk, that maybe we also suffer from trying to boil the ocean a little bit. I mean, and we talk about diagnostics, and it's such an all-encompassing element to all diseases. And where do we start and where do we make improvements? So maybe we need to start thinking, as the Global Fund does, on very specific fundamental diseases, get those off the table and dealt with, and continue to build and evolve as those technologies are made available.
Thanks, Lance. Sanjeev, I want to build on what Lance was saying. Perhaps you might want to comment whether you agree with what you're just saying. We should be looking at particular disease areas and focusing on them first. One of the biggest challenges, of course, whenever you're dealing with governments, is trying to persuade them to spend money now for future returns when they want instant returns in many cases. Do you see the way that diagnostics were ramped up during the pandemic, perhaps changing that mindset a bit in government?
Yes. First of all, there are many health concerns still in this part of the world, as we all know. All the diseases like HIV or hepatitis, or even vector-borne diseases like malaria, dengue. These are still concerns and huge concerns. Now we see, through the spectrum, different countries respond to this situation differently. There are countries which have been very proactive. They have been building the capacity and capability towards resilience healthcare infrastructures, whilst some other countries we see, they respond and react to the situation as and when it comes. There could be different reasons for this, but I think to your specific question, whether pandemic has changed, definitely it has changed the mindsets among policymakers and the various government stakeholders. But whether it is sufficient, that is still to be seen.
I hope you're right. My view is governments tend to have short-term memories. Unfortunately, they'll forget about things pretty rapidly. Yes, Lance, you want to come in?
Yeah, I think one of the areas that we did see, one of the areas that we did see a shift in is, of course, the regulatory landscape associated with the urgent need for COVID tests, right? And I think there's some learnings and some lessons here. I mean, quite often a delay in getting technologies into a country is related to the regulatory hurdles that need to be gone through. And let's not forget, we are dealing with health, so the regulatory hurdles should be there. There's no question about that. But then, can we be smarter about this? And what comes to mind is the regulatory reliance project that APAC Med has been working on with a number of the ASEAN countries, where we're trying to get smart about not having to do all of the same work in every single country, but countries coming together and going, yes, what you guys have done there makes sense. We trust that. We do perhaps a light validation of a technology and then bring it to the fore. So I think this is something that COVID tested, if you like. It was sort of there in theory. COVID really tested it. And I think as healthcare professionals, we need to be willing to explore that much more and say, how can we reduce the self-imposed barriers that we may have to ensuring that good technologies are put in the hands of the people that can do good with them.
Very good point. In fact, as Sang also, ASEAN's been exploring more on the pharmaceutical side of life as well as learning more from each other. Dr. Lui, please.
Yeah, I think, in fact, the COVID pandemic has changed the landscape to the extent that positive for diagnostics, in the sense that I think the policymakers are more willing to listen to the stakeholders, to the professionals, and to the healthcare workers with regards to long-term plans. I think this is a very opportune time. So it is a time when we can persuade them that investment in diagnostics will have a lot of returns. But obviously, we have to draw in academics and others as well, because we need data. And generally, without good studies and data to support what we say, may mean that things may fall flat on your face. I mean, if you say that investing $1 can return you $10 worth of good health for the public, you should be able to back this up with some kind of data. And I think this is where there has to be a concerted effort with health economics and other academics to find that kind of data and bring that message forward. So what I'm trying to say is, I think policymakers, I know politicians all have short memories, they want immediate results. But I think in this climate, they're going to have to answer to the public in terms of how to prevent this sort of things from happening again. The public is now very aware about diagnostics. They want to know more about themselves. They want to know more about well-being. They understand tests a lot more than before. I think they understand about investing in health, and the politicians and policymakers have to answer to that. So I think it's a good time.
Dr. Liu, do you think there's also a role, though, for diagnostics in addressing concerns around the rising cost of healthcare? I mean, here we are in ASEAN, which is now a relatively young region, but it's going to be aging extremely rapidly very, very soon. That means healthcare costs are going to start going up.
Yeah, healthcare costs have already started going up, and diagnostic costs is going up because, in a sense, in countries in ASEAN are the users of diagnostics, but they're not the manufacturers of diagnostics. I think this is one major concern which the Lancet Commission has also pointed out. That lack of matching in the equation is a major problem. And I think the answers to this may not be immediate, easy, but it does mean that the investments in diagnostics is not merely investing in buying diagnostics, but also investment in creating diagnostics, in being able to manufacture your own diagnostics. I think it has also been mentioned before. With making your own diagnostics, this also means that you have to build the capacity and understanding of technology. So the pandemic has shown us that those countries that have, say, PCR technology capability, because they have that research capability, and then therefore they can translate that immediately to practice very easily, they could easily develop the kits and then rise up to making their own diagnostics. Whereas those countries that did not have that capacity in terms of capability, research capability, could not do it. They have to actually buy everything from other countries at great cost. So the point is I'm trying to make is that investment for the future and for diagnostics also means investing in research and technology and innovation. We need innovative approaches to a lot of the problems of health, and innovation has to be translated into innovative diagnostics. If you're going to bring diagnostics to the primary care and community level where the huge crowds are and where the aging population is, it has to be different from the diagnostics of today. It has to be easier, it has to be affordable, it has to be able to go out to the rural communities. The diagnostics of today have to change. And we do see there are changes. We are adopting wearables, mobile apps. We're talking about POCTs and so on, but we still have to push further in that area. And in the other area of precision medicine too, we have to push for more innovative technology, something different, so that the genomic tests and mutation analysis do not have to be so expensive. And it could be locally produced and locally regulated. Thank you.
Thanks. Eduardo, you had your hand up first. You want to interject, and while you're interjecting, perhaps you want to address the question of how we get diagnostics to the more disadvantaged and more vulnerable in societies.
Okay, thanks, Chris. Chris, I think also a challenge, of course, is how diagnostics are sold to governments. Okay, so it's like one way sometimes being seen. The problem has always been you sell it, governments don't maintain it well, there's obsolescence. It's not your usual something, investment product. And I see Lance, I probably would love to listen to what Lance is saying. So I think one of the challenges that we're probably looking is if you could design that the way diagnostic is sold. It's always been a favorite of people advocating PPPs, particularly when you clinical services PPPs, because there seems to be an admission immediately that most governments would be unable to maintain the diagnostics quite well or on long term. So it's better to do it. So I think that would be part of if we could simplify or make it easy for governments to procure diagnostics, then it will be it will be a much more easier. It can how do we call it? Facilitate governments investing to diagnostics. Chris,
thanks. Sanjeev, you had your hand up as well.
No, I just wanted to have a comment on what Dr. Laile Meng mentioned and later Eduardo mentioned. So I fully concur with them that we need a totally different diagnostic solutions and technologies. For example, given the topography of our area and this part of the world, point of care testing can offer a huge solution because it can offer and enable a more efficient use of healthcare resources by alleviating the already overburdened hospitals and the central labs. Point of care can also bring where the patient is through decentralization, and it provides better access through democratization of diagnostics and improving response and outcomes through digitalization. I think these are some of the potential solutions, and also these are some of the lessons that one has learned through this pandemic. But fully agree with both the comments.
Thomas, at the Global Fund, you've introduced a pooled procurement mechanism as a strategic initiative to help ensure that quality goods are purchased at the lowest possible price. What does this mean in terms of diagnostic tools and systems? And is it a model you think could be replicated across Southeast Asia?
Yeah, the pool procurement mechanism has been running for about 10 years now, and it transitioned maybe 5 or so years ago into what we hope is a global public health good, which is called WAMBO. And anyone can see it by going onto wambo.org, and you can take a look around and see what products are available. And this is a platform on which all countries that have ever had a Global Fund grant, so considering more than 100 countries, can access quality assured goods negotiated at bulk rates. We do periodic tenders with our estimated global volume, and that allows us to get better rates. What this means is obviously good news for customers who should get better prices. Also good news for the adoption of new technologies because they can be rolled out to more places more rapidly. It's not obviously such good news for global suppliers because they might not be able to achieve the same pricing power, which they could if they split the market up country by country. But they can access very large order volumes, so often they're quite happy as well. So regarding replication, in theory, the model can absolutely be replicated. More than 620 million people living in ASEAN, plenty of scale, you'd expect bulk discounts. When we think in practice, aside from the questions of sort of operational experience and learning, going back to to sort of riff on what Lance was saying earlier, one of the most important factors to consider here, one of the barriers to pool procurement often comes from national legislation that provides for privileged or sole distributor status for a company that's the registered supplier in that country. And whilst waivers for, in our case, donated goods are sometimes possible, getting them is difficult and resource intensive. And I am not opposed to that model per se. You know, a sole distributor pays for the right to be the sole distributor, and that's factored into their return. And obviously they should be considered when we are looking to import an identical product into a country where they've paid for that. However, what I'm saying is that there are, going back, regulatory barriers or legislative barriers to doing a pool procurement system, which will have the volume of the total sum of all the demand in all the countries. There's also another point on regulation here, which is when we're talking about a world which is resource constrained and we all don't quite know how we're going to get the money together to pay for all the things we need to do, often changes in regulation are, if not free, materially pretty cheap. And there's a very good example with things like digital X-ray, whereby digital X-ray is in some countries still regulated in as if it were a traditional X-ray because of the radiological aspects, but digital X-rays emit very little radiation. And so little tweaks in our regulation, taking into account new technologies, can result in both big savings and much better adoption of new technologies. Just one last thing to say, and this may not be in line, because I know that one of the things you're looking at is establishing a kind of pool procurement mechanism for ASEAN. It's important to say that a large proportion of ASEAN countries can already access the Global Fund's pool procurement mechanism, at least for the products which we cover. So you can absolutely do it. You'd need to check the benefits or whether or not it would be a complement or a substitute. But yes, absolutely, it can be done.
Thanks, Thomas. Lance, picking up on this theme of affordability and accessibility, how do you see, from a Roche point of view, diagnostic technologies being utilized in a way that means they are affordable, accessible, and sustainable for the region?
So a thought going through my mind as this conversation's evolving is I think we need to be very careful that we don't start to simplify and talk about all diagnostics being created equal, right? I think it's really important that we understand that. If we think about what's front of mind, rapid antigen tests, for example, for COVID, we've all experienced those, and not suggesting it's simple, but there's no associated analyzer with that test result being generated. And this is where we get into a very different arena. So if we look at the investments that we've made and countries have made into PCR technologies, high volume, very clever analyzers that are like hand-built cars, that's not something that you're buying like this and you haven't got a volume story. But in terms of the best way to utilize that resource once the investment has been made is to use it, then it becomes a volume story. So put more tests through it, push more tests, then the testing costs can come down. But we should not confuse or oversimplify the diagnostic environment, because if I then go into anatomical pathology lab for diagnosis of cancer, I mean, the science is insanely complex. So we shouldn't dumb down this diagnostic storyline and suggest that volume is the answer and it's all simple and anybody can do it, because actually, I'm sorry, you can't. Then when you add to that the regulatory dynamics that have got to be developed by a manufacturer to get that product on market, the clinical trials, the time taken for that, this is critical stuff, but we shouldn't oversimplify it. I think there's room for more innovation out of the lower cost environments. I absolutely believe that, and I think that's where we need to continue driving. The question is it leading edge innovation with brand new technologies that we need and haven't seen yet? Or is it Me Too products that are manufactured at a slightly cheaper price point and therefore giving alternatives? What I'd love to see is more of the front end diagnostics, the new technologies that we'll need moving forward, which are at a much lower price point to manufacture, to scale, and potentially scale at a global level. To that end, what we do, for example, is we've launched an innovation hub within Roche Diagnostics Asia Pacific to tap into our Asia Pacific environment and try and make sure we're abreast of all of those technologies, which may lead to the next breakthrough, if you like. So I think that's key. I think utilizing the investment that is already there. I mean, we talked at the very beginning where there's labs that exist, full-scale labs that exist in all of our ASEAN countries, but we're not getting to the whole population. So we don't need new technologies for all of that. We've just got to use what we've already got and get out to more people, for example. So I don't think it's quite as simple as just making it all more affordable, which is, of course, what we all want to do, and certainly volume helps that. But it is a complex equation that we're dealing with.
So use what we've got in a better, smarter way, is essentially what you're saying.
That's a low-hanging fruit, and keeping an eye on and constantly encouraging the new technologies, which will be a step change to the technologies that we're all using today.
Okay. There's a question in the Q&A, which I'm going to put to Lance and to Sanjeev together, and perhaps Sanjeev might want to address it first. And it's like, the question is, investment in diagnostics is not just about purchasing diagnostics. but it should also be about investing in manufacturing them. Do you think ASEAN member states have that capability?
Yes, I think both in terms of developing the new diagnostic tests and the relevant diagnostic tests, and manufacturing and then scaling the overall operations. Definitely. In fact, two of our own manufacturing facilities are within this region. So this is definitely doable. This is definitely possible.
Yeah. You agree, Lance?
Yeah, absolutely. I echo that. I mean, many of the IVD companies, as Sanjay's described, are manufacturing either parts of their solutions, or in some cases all of their solutions in the ASEAN region or across Asia Pacific more broadly. So to me, that's not a question, and that's currently being utilized now.
Okay, Thomas, you want to jump in?
Yeah, I was just going to say, completely agree with what the other two panelists said just now. And I also entirely agree with what was said before about, first of all, diagnostics is a broad church and contains many elements. The thing which I would stress is that often buying the diagnostics is the easy part. You really have to think about the whole system which surrounds them. So how can we ensure availability at the point of care? Even there are no shortage of instances of diagnostics being bought and sitting in a port for quite a long time, just because they simply were not distributed to health facilities. And I'm talking about sort of the most basic rapid test kinds of diagnostics. We often find that frontline health workers are either not adequately trained or not adequately incentivized to actually use the diagnostics once they have them in their hand, or if there's inconsistent supply of diagnostics, they either forget how to use them or don't want to use them in case they run out. The other thing is, obviously, in this conversation for more complex considerations, lab staff, how are they incentivized? If you're incentivized to run one test and not another, you'll probably end up running the first test. So that, yeah, there's a whole system to think about here. Often the product which goes in at the start, whilst it can be very complex, is only 50% of the equation.
Thank you. Dr. Louis, I'll bring you into the conversation on this point. I mean, how can we make diagnostics more integral to the healthcare systems in the region? How can we get policymakers, or indeed perhaps the medical profession, to making greater use of diagnostics?
Well, I think what is important is the dialogue between healthcare workers and the policymakers. And that has to be stronger, and have to be more open, and have to be more honest in a sense. So that dialogue is going to be very important, and there has to be more moves made to improve on that dialogue. And I think in that regard, to improve diagnostic testing capability and coverage requires, in a sense, an adoption of the WHO Essential Diagnostics List into the region and into the national level. Developing an essential diagnostics list, I think, with a proper multi-stakeholder input towards that development, will increase that commitment from policymakers as well as everybody else, that, okay, this is what we need at this level, because that is the healthcare provision and the requirement of that level. And that's what diagnostics must be available for that level. What Eduardo said just now, I think, is what I'm referring to. If you're trying to say that at primary care level, do you need ultrasound? Do you need what? Let's have a decision. What do you need at that level? Depends on the health problems of the country and of the community. And that's why at the primary care level, you need this, or else you're not going to be able to capture the problems of that level. And therefore develop what is the diagnostics list required for that level. and what is required for the middle tier level and what's required for the high tier level. And then have an intelligent conversation of how to provide the diagnostics for that. I personally believe that that's going to be a very important move to really get down to this essential diagnostics list. Focus on what is of value to that particular country, that particular community, or province, or whatever it be, rather than just blindly adopt a list that may not be relevant to the healthcare problems of that country or of that region. I think in the past, a lot of policymakers have run into trouble because they just adopt what other countries do. And very often we just adopt what high-income countries do. And we say, oh, we try to improve our system by emulating one of the high-income countries, and we pour a lot of money into it. And it's not done in a logical manner. It may not even be relevant to the healthcare problems of your particular community. They may have other problems. Perhaps dengue perhaps may be more important than something else, and you don't have the tests for that, and so on. So I really think that the first step to improving diagnostic capability is that dialogue and developing the essential diagnostics list. And of course, to reduce the cost means that you have to convince the healthcare and government to invest. And this is a point I've made before. I'd like to make it again in a sense, to invest in capacity, in people who have the ability to use technology, invest in the training of pathologists, technologists, scientists who can adopt and adapt new applications very quickly. And thirdly, to invest in quality. That point, I think, hasn't been brought up. I like to bring it up. They have to invest in quality assurance systems and accreditation systems, because we do not want new technology to be developed and then fall flat on its face and people don't trust them anymore because they do not live up to what they're supposed to do. Thank you.
Thank you. Eduardo, talking about the financing of health systems, the Council itself did a paper actually a couple of years ago now on sustainable health financing. Is there a way in which we can persuade policymakers of the value of investing more in diagnostics? I think we mentioned earlier, investing more now would actually save lives. Thomas mentioned that, there are tests out there that can actually save lives for finding out about curable diseases. So what more can we do to get health financing in a position where it can be redirected or increased in diagnostics?
Chris, I think I already said, sorry. I'm trying to save on bandwidth. I think Chris already basically said some of the points I've raised, right? I think the argument that diagnostics have value, can save lives, that's already an argument that policymakers have heard over and over again. I think with COVID-19, with the pandemic, that's just been really very bit emphasized. And we've seen them invest a lot on diagnostics. But but moving forward, it's really trying to make this investment something non-health people understands. If we keep on arguing that this should be done with very specific diagnostic equipment and all that, that's difficult for decision makers to look into. So if we could really package this, so as I said earlier, package this as part of the primary care story. You start investing in primary care, this should be part of. Or package this that it will remove a lot of the questions already policymakers, the obsolescence, the depreciation cost, the maintenance. So when you start talking to government and telling them, okay, you invest in this, and by the way, when this investment is done, this is already part. The training, this should be. We have to be creative in how this should be packaged as investments. Not the way in which you sell to specific hospitals. That's quite difficult to get. I find it difficult to get government to invest much more if that's the way it's being sold. Chris.
Okay, thank you. We're heading towards to the end. I've got a couple of questions which I'm going to pose to to all of you and give you a chance to respond on them. The first one is ASEAN currently on track or off track to reach their SDGs by 2030? And how can investment and adoption of diagnostics help get them back on track and also achieve their specific health cluster goals by 2025? I'm going to be a bit unfair and throw this one first at Sanjeev. Sorry, Sanjeev.
Yeah. No, I think definitely the countries have to now invest in diagnostics if they have to achieve these goals. And this, in my, I personally believe the need of the hour is to have a combination of centralized settings with point of care settings so that we can have a better access. And that's the point that I mentioned earlier, that will democratize and make the accessibility of tests, diagnostic tests to the larger populations. And this will help achieve health goals. So that is one aspect. And the second is not only invest in centralized capacity and capabilities, but also decentralized capacity and capabilities. And the third is, of course, besides the very quantifiable investments, we also need to look at knowledge sharing and the best practice sharing among other countries, which can also help achieve these goals.
Thank you. Thomas, I'll come to you next. Just what's your view? Is ASEAN on track, and how can it get better on track if it's off track?
Yeah, there's a nice website called the Sustainable Development Report, which anyone can access. And if you look at the globe, and this rings true for ASEAN too, you see a sea of red. There are a few countries which have what's described as challenges, and the vast majority of countries have either significant challenges or major challenges when it comes to SDG 3. In terms of getting back on track, just a couple of thoughts. One, I'm aware this is a conversation about diagnostics, but we do have to think about the total patient. There's not much point in diagnosing in isolation, and the treatment is also key. To going back to what I was saying before, just think about it from a perspective of systems. We shouldn't focus on diagnostic product availability or diagnostic manufacturing solely. We do have to think about it as a system. The other thing I would add is whilst that is currently a sea of red, there's a very obvious reason for it, which is many responses fell backwards heavily during the period 2020 to sort of the end of 2021 because of the COVID pandemic. There is reason for optimism here. Before the COVID pandemic, many disease programs were making good progress. And afterwards, we're seeing in our data on TB, on HIV, that there is a recovery in terms of diagnostic coverage, treatment coverage in this region. It's not the level we need it to be. If we extrapolate our data out for TB, for instance, from the first quarter of 2022, we should end up with about 78% case notification for TB across our high impact Asia region. It's not at 90% where it needs to be, but it's a big way up from the almost 55% it was a couple of years ago.
Thanks. Lance, what's your view? What more can we do to help the region?
Yeah, I think Thomas has provided the facts and the data behind my gut feel. I think I'll come back to what I said at the beginning. My observation is that some of our ASEAN countries have been hit much harder as a result of COVID and taken slowed up in their development towards these goals, and will need more help. I like the idea that Dr. Lai was describing about facilitating these conversations around specific areas of health and what diagnostic tests and tools are needed in primary care, for example, versus secondary or tertiary care. And I think that might be a really profound way of trying to attack this problem that is very broad and far-reaching. So, yeah, I guess I'd stop there.
Okay. There's one question in the Q&A, which is one I'm probably going to end up with. But it was directed towards Lance, but I am going to direct it to all of you. And I'll start with Dr. Louis, I think, for this one. What are your top 3 calls of action to policymakers in ASEAN to enable sustainable access to diagnostic solutions for patients?
Thank you. If I have to talk about the top 3, I would say, firstly, the dialogue, developing the Essential Diagnostics List. I think that's going to be very crucial. Have an honest discussion as to what is actually needed at different levels and what should be the action plan to develop that. The second most important would be to improve capacity to adopt technology in ways that benefit people, benefit everybody, not just benefit one area of the population, not just benefit the rich, not just benefit the industry, or not just benefit the visibility for politicians or whatever, but develop, adopt technology that will benefit everybody, and invest in people who have the capacity and the capability of adopting and innovating new technology. That would be my second priority. And the third would be not to forget quality. I mentioned that just now. I just want to put a point here, emphasize. In this huge rush to develop diagnostics and produce and deliver to the people, don't let it fall flat on its face. Make sure there's quality attached to it. Do not sort of shortchange quality assurance programs, quality checks, capacity to control, and make sure that only quality products go out to the people, not just all kinds of fake products going out, as we've seen. Fake news, fake everything, fake medicine, fake diagnostics too could really infiltrate, and that would be disastrous. Accreditation programs should be strengthened, and make sure that labs know what they're doing. People who are doing tests or develop tests know what they're doing and produce quality. And if you're talking about POCT, that this should also have a certain amount of acceptable quality. So just this would be my 3 top. Thank you.
Thank you. Lance, as it was directed to you, I'll come to you next.
Thanks, Chris. Not sure why it was directed at me. I didn't actually have 3 initially, but I would echo. I'd like to see countries and us pushing the narrative around what are the critical tests needed at what point in time, the Essential Diagnostic Test List, as has been described. I think that's a fundamental. With a view to establishing base or foundational leverage diagnostic coverage to support the entire population. I think that is the key focus area for me in the ASEAN environment. And then the third one would be look to maintain the quality, but let's be smart about it and not necessarily suffer from not invented here syndrome, and be smart about leveraging the other ASEAN nations, and a big plug on the regulatory reliance framework that we're trying to work through. Those would be my 3 areas.
Thanks, Lance. Sanjeev, do you agree with Lance?
Absolutely. I echo what Lance said, but in addition to that, I would also say a common and efficient regulatory framework. That will go a long way. And of course, capacity and capability building is my second point. And the third is having diagnostic guidelines, learning from other countries, and then adopting those guidelines and as part of diagnostic protocols. And also, as Dr. Lai Louis mentioned, not looking only at diagnostics, but or testing, but test and treat solutions.
Okay. Thomas, for you at the Global Fund, I mean, what would you say were the top 3 priorities? And would investing in people be one of those? Is the question I want to ask you.
Yeah, absolutely. It consistently is. That I was going to agree with what many of our colleagues have already said. I think my direct answer to the question would be Think about the whole system, not just the product. Echoing what was said before, focus on quality and do not focus on what comes from your individual nation. The last thing I'd say, which I don't think has been raised yet, is make sure the incentives are correct for your health workers and the other people who will deliver the intervention. If you incentivize hospitalization, you will end up with lots of hospitalization. If you incentivize performing one test rather than another, the first test will get done and the second won't.
Yes, that's a problem. Actually, here in Singapore, if you've got health insurance, they do love to send you a test you may not need because they're incentivized to do so. Eduardo, I'm going to give you the final word, your top three, and perhaps you could also talk about how we can deliver better in terms of public-private sector dialogue on this topic.
So you're saying that what three, you know? So
yeah,
I think the first one I think is that your report that you did, I think that's really a big step. We haven't really sold the story of the value of diagnostics well. Okay, probably because that it's so broad. So how it can actually help the economy and all that, you know, how cost benefit. These are what a lot of policymakers outside the health sectors are looking for, and I haven't heard this quite well. Probably quite specific for certain conditions, but no diagnostics in general or diagnostics in primary care. This type of presentations, discussions, I haven't heard. So if this can be done and presented well, that would be good. We talk ASEAN, you know, how investment in diagnostics can actually help address some of the things that are priorities of ASEAN. You know, ASEAN wants to build more tourism, more travel across country. You know, so how you relating it to ASEAN priorities would also be something I would, you know, if I get when I talk to policymakers, I want to highlight that. So I think so if you could with your work or with others get this more be presented in a manner that's easily understood by policymakers, then that would really help. I'll stop there, Chris.
Thank you. Actually, we have plans to roll out a series of roadshows across the region over the next 6 months to 6 different markets to help develop this conversation even further. That brings us to the end of this launch webinar. I would like to thank my panel very much for joining us. It was a very, very stimulating, interesting conversation. My panel, for those of you who are listening, are actually scattered all across Southeast Asia, and in Thomas's case, in London today. Big things I've learned today. Well, diagnostics is absolutely key for the entire healthcare journey. Thank you for that comment, Sanjeev. That one's going to stick into my mind. It's not just about big flashy machines that go ping as well. It's about very often more simpler tests that we need to do, but we need to have those tests coming out more, covering specific diseases in different markets and reaching a broader audience. And then, of course, making sure we have the capability in terms of physicians and nurses to help administer them as well. We'll keep the conversation going, as I mentioned, in different markets. Please look out for those roadshows as we begin to roll them out across the region. And please do go and find our report on our website. Thank you very much again to my panel and to everyone joining us today. Keep safe and keep well, everybody. Goodbye.
Thanks, everybody.
Thank you.
Bye-bye.